are students here at the college. And how many of you came because yourself or a family member is diabetic? Okay. Wow. Okay, good. Okay, thank you. You know, you ask about the science, and if let's just talk about type 2 for a moment, because 8 out of 9 diabetics right now are type 2. Yes. If you ask most type 2 diabetics where diabetes comes from, where would they tell you?
Sugar. Sugar, yeah.
Sugar. Well, it comes from eating sugar, right? It's poor diet, poor lifestyle, right? Well, if you actually just go look at a lot of the research that's been done, and I've taken the time to do this, it's very interesting because this raw food is all about enzymes, right? You heard them talking about enzymes.
Mm-hmm.
But it's very interesting that every cell in your body makes enzymes, right? They're not digestive enzymes necessarily, but they're enzymes that help you carry on the processes that go on within the body. And when the body's making its enzymes, when cells make enzymes, they're healthy. And if you read Guyton's physiology, you'll read that when the body begins to get toxic, the cells make less of those enzymes. And if you also read the research on type 2 diabetes over the last 15 years, there were studies done in England that show that antibiotics cause diabetes. There were studies done in Korea that show that high levels of organic pesticides cause diabetes. And as you're going through the science that's already been done, no science needed, no more research needed. As you go through the science that already has been done, it seems to indicate that diabetes type 2 is a toxicity disease. And actually, diabetes type 1 is a more significant toxicity disease. People are more intoxicated. And the word toxic comes from a word toxicon, which meant from the bow, and they used to dip arrows in this poison, and they would shoot animals, and they would shoot people they were at war with, because they knew if they just got them a little bit, they would eventually die. So toxicity means the person's been poisoned. So now I'm going to ask you kind of a question that's, don't get upset with me, I'll ask you the question anyway.
Okay.
If you take a patient who walks into a doctor's office and the patient has diabetes, what does the doctor have to think in the back of his head if he's read the research over the last 10 or 15 years? And I can probably give you 25 studies that show that, study done in the Journal of the American Medical Association in 2008, show that increased levels of arsenic in the drinking water cause much higher levels of toxicity, or of type 2 diabetes within the populations there. So if a doctor has a patient walk in with diabetes, do you think the doctor might say in the back of his head, this patient is toxic? Do you think he might have that, should he have that viewpoint?
Sounds like it from the research.
Yeah, exactly. But he should have the viewpoint, I have a patient who's toxic, he's been poisoned. Correct?
Mm-hmm.
So if you take, I'm just going to ask you a common sense question here. This is not science yet. I'll back up more with science if you ask me to. But if you take a patient who's toxic and give him medication, now, are all medicines toxins? What do you think?
Yes.
What do you think?
I guess it depends on your definition of medicine, but for purposes of this exercise, I think I see your point. You're feeding toxins with more toxins.
Right, so if you take a toxic patient and add toxins, can you get a healthy patient?
Probably not.
No, so if you can just think with that for a little bit, I mean, I don't think there's any more science needed, but let me say something, okay? They just did a study not too long ago with patients, you know that metformin is the #1 drug used for diabetes, right? So they took a bunch of young kids who were not diabetic but were overweight, and this is the new program for metformin. We're going to sell more metformin, so they started putting a bunch of teenagers who were overweight on metformin. And after 48 weeks, I believe, they had lost maybe 3 pounds, or 3 to 5 pounds, 5 to 7 pounds, but not a dramatic amount of weight for someone who's significantly overweight. But virtually every one of those patients had problems with everything from headaches to nausea to diarrhea to, you know, all these things. So if you look at what happens when you give a healthy person these medications, it isn't good. And there are many other potential side effects from metformin, but just the results are not necessarily that good. So if you see when you give these healthy people those drugs, they actually get worse. They get sicker. Actose, one of the medications that was mentioned on here, if you read the research on Actose, it says it causes heart attacks. It dramatically increases the risk of heart attacks. Patients who have type 2 diabetes and are taking one medication, I believe, here's what it was. They did a study with people who were type 2 diabetic, and they found that once they started on medication, a high percentage of these people became depressed. So there was a dramatic increase in depression with diabetic patients. But there were a number of patients who were diagnosed with diabetes, and they didn't take any medication. They just sort of neglected the disease or whatever. They didn't get depression. So the doctors said that the depression was caused by the extra stress of having to remember when to take their sugar and when to take the medication. And I thought, well, maybe the depression is caused by increased toxicity. I mean, you can look at the sciences out there. Avandia is about to be taken off the market, it looks like, right? Why?
Because GSK didn't publish the results of all of the heart implications.
That's right. So if you really want to look at science, what you will see, 73% of diabetics have high blood pressure. Almost that many have high cholesterol. The statin medications are used for everybody who, well, not everybody, but a preponderance of the people who have type 2 diabetes, even if their cholesterol is not high, are put on statin medications. Statin medications rob the body. They stop the production of coenzyme Q10, which is a major energy source for the cells in your heart. And they also are shown to be toxic, which means poisonous, to muscle. What's the most important muscle in your body? Heart, right? So people take cholesterol medicine in an attempt to protect themselves from heart attacks, and the medicine damages their heart. So if you want to talk science, there's been a lot of science done. I actually want to start a foundation. My clinic in Santa Clara is called the Human Engine Clinic, because I teach people that their body is an engine. And in order for an engine to run, it needs fuel, it needs oxygen, and it needs a spark, your spark plug.
That was a very comprehensive answer. I appreciate that. I have to tell you, I'm encouraged to hear that perspective. I really am. I have spoken with many physicians over the years about diabetes and have not ever heard this idea that this toxic premise and theory that you're putting forward. And I frankly agree with it. I think it makes sense. I have not seen the science that you've seen, obviously, in terms of studying toxicity for some of these drugs and the state of the body, but I think it's a nice compliment to the film, and I appreciate the comprehensive answer.
Thank you. By the way, I am not a medical doctor. I'm a chiropractor. Did I say that?
Mm-hmm.
Okay, well, I'm a chiropractor. And chiropractors, you know, in the United States, there are naturopathic physicians, there are chiropractors, and there are acupuncturists who are considered primary care. There aren't enough of us. And the insurance companies have kind of pushed us out of the mix, so that a lot of the work that we can do to really help people, it's just not allowed. So a big problem right now is health insurance, because when someone has diabetes, actually from 2002, American Diabetes Association said that the average American spends about $2,500 a year on health care. And the average diabetic spends just over $13,000. So there's almost an $11,000 difference. Now, when I work with people in my clinic, I usually do at least 6 months of intensive work with them, and it usually runs somewhere between $5,000 and $10,000. Now, believe me, that is not a lot of money for 6 months of work that we do. But usually, once a person establishes the habits they need to keep their blood sugar in check, to eat properly, etc., they move into the realm closer to the $2,000 a year person. So they save $10,000 a year.